Hello, so my name is Pedro, and I'm the head of digital health and value assessment at Collab. And I'm going to be the one to present to you the panel of digital healthcare in measuring outcomes for both short and long term. I would like to thank Ana Rita because she gave me the opportunity to present two unique case studies that we have been working since the beginning at Collab. But before, I just want to start with a definition, because in this panel, we will have experts from different sides, from different backgrounds. And what I learned in the years that I've been working in the sector, if we don't talk about the same concepts, we get lost. So digital health is actually a new fashion or a new way to deliver healthcare services in order to monitor and improve the well-being and the health of patients, but also, and most important, empower patients in the management of their health and their families. So this definition should be keeping the discussion for whole the session. But also, I'd like to go a little bit back and see the evolution of what we came so far. So since the 70s that we've been talking about telemedicine, telehealth, and so on. Then the internet appeared in the 90s. I was very young, and we looked at e-health. And now with the appearance of mobile devices and smart devices, we get into the concept of digital healthcare. But what I find really interesting is what the Lancet Digital Health Journal published in their first edition in 2016. So we see technology all around us, since from pockets from the nurses and the physicians until every room in the hospital has a computer, but still citizens don't believe that the technology can have an impact. And we suffer that last year when the COVID-19 pandemic appeared, right? Because there was no system for digital healthcare. So everyone was expecting that technology would cope fast, would accelerate all the things that we were being challenged, but we couldn't solve it. And what we would like to discuss in this session is also that. So both the potential for digital health, so for digitizing the healthcare services in different levels of the system, but also trying to look at data and trying to extract evidence from this data and help our patients to cope with their problems in diseases and well-being. Digital health service, of course, have enormous potential, since increasing the capacity to treat more patients, improve health literacy through different communication technologies, and also provide remote health care while reducing operating costs and patient costs. But with opportunities come challenges, and I'm not going to highlight all these challenges because I have experts in this panel that are going to tackle for sure one of them. Here at Collab, we are mainly focused on the lack of awareness of the added value of these technologies and the different interests and values of different stakeholders. While again, because there's no system for digital health. And if you recall the presentation of Professor Moore in the morning, he was always talking about that. We have to look at the system as the whole system, right? Because we are not just one or two stakeholders, we are several stakeholders working together or not together. That's another thing that I would like to discuss with the experts, is that everyone has to be winning in order to cooperate and to collaborate with each other, in order for the patient and the citizen in the end get the opportunity to have a high quality care service. So from the strategical level, we went for the operational part. And in here, we try to design a new methodology that will help us digitize the service while the patient is on the center, but using all the stakeholders that belong to the network. So we started characterizing the existing outcome pathways. Then with medical teams, with the patients, and with the technology partners, we try to co-create a new digitized service. We test with small sample of patients, trying to iterate with them and trying to understand what is wrong and what were our beliefs that didn't go well as we planned in the paper. And then with that, after several developments, we are finally ready to scale. And this was the methodology that we use in these two case studies that I'm going to present you. This one is based on Santa Marta Hospital, and these were patients that were submitted to cardiac surgery, and they were doing a follow-up period with the medical team through over 1 year. We started with a pilot with 35 patients with the founding partners of the Vocal Lab, and now we want a research fund to expand and to scale this pilot study for a clinical trial with over 300 patients. This is the digital health value network that we designed. So this is important for us because it's good to know which partners are involved and which not. And maybe in the future, we could integrate them in our network and also add value to them. What was the cardiac surgery that we were trying to propose? So this nurse team, this incredible nurse team that were working at Santa Marta Hospital, were working with 12 months with each patient, calling them 3 days, 1 month, and so on, trying to collect outcomes to understand how they were recovering. But the most critical period was the first 30 days. So this was an opportunity to digitize and to get more data to that. Okay, so we went to the hospital, we followed the doctors and followed the nurses and designed the whole pathway. So in the blue part, you see the digitized version. So what we propose to be a complementary service for the existing one. After that, we tried to see which outcomes the medical team and the patient believed were the best in order to really characterize their pathway. We try to integrate everything in a platform that would improve the follow-up service, and we are already collecting costs. I will leave that for the next panel, so you have to keep up with us. And this is the telemonitoring service. So used front offers already proved to be successful product. It was a mobile app completely designed for cardiac patients, and it proved to be working. So what we did next was to increase this platform, creating a new venue for communication between patients and healthcare professionals. So in this case, patients send their wand pictures every single day to the nurses, and the nurses can actually give feedback on how the wand is going on. And one of our experts is also from Vodafone, so I have to push the talk to here. Vodafone was very important for us in this process because made everything connected. Okay, so all the data was secure and connected between the devices. In here, I want to show our first patient, which is in our hearts from all the team members, because he was totally committed to help us in coming up with a solution that was good for everyone. On the second picture, you see Flavio and Carolina, which are members of our team, trying to figure out how they should display the results to the nurses so they could quickly react on the data collected. On the last picture, you see the kit, so the mobile app and the scale, wristband, and blood monitor pressure that were connected to the smartphone to collect the data. After collecting the data, so we had to display it, right? And this was the system that we call it Bitnik. It was developed inside our team, the team led by Flavio, and all the graphs were trying to accelerate the decision power of the nurses. It even has a notification system that can show quickly to nurses which patient has gone wrong in some kind of outcomes. This is the total, the average of the pilot study. These are our patients. The experience was very successful. All of them told us that they were their safety perception has increased with the kit because they felt they were closer to the medical team. This is our way to look at the value analysis as a whole, and then we will talk more about costs in the next panel. I won't spend time. And then I will show you very quickly the next project that was funded by North 2020 and Portugal 2020 to support digital solutions for the populations at risk for COVID-19. And one of our experts is actually from PLUX, which is one of our partners that is providing the sensors to collect more data from these patients. So this solution was to be integrated in a nursing home. It would need to allow to collect vital signs and symptoms from the elderly, but also access to video consultations in order for healthcare professionals outside the nursing home could interact with the patients and trigger better therapies. We follow the same data collection protocol, so I'm not going to spend a lot of time. You see that our value network increased in the number of stakeholders, increased the complexity also, and we had to deal with that. And to see how we could still add value to all stakeholders involved. We have 10 patients going in the pilot. The pilot already started, and we have a very diversified healthcare professional team. The use cases that we digitalize, I just want to highlight one more because that's an upgrade for what we have. It's the patient medication taking routine that will let Jaime have his point on this, because it's a strong point for pharmacy in here from the pharmaceutical sector. And then we also had health literacy. So trying to adjust all the questionnaires that we had here in collecting outcomes in order to fulfill the needs of all types of users that we had. Another plugin, and I promise that I will finish as fast as I can, is that we also add research design on this. So we wanted to have a solution that could be easily and fast access for for the healthcare professionals and for the patients. So as you can see here, all users can easily tap on the tablet or on the smartphone in order to complete the collection of the outcomes and check the vital signs. We did several interviews with our users, and they were very useful to get even more information concerning icons, type of the size of data. And I think Professor Nuno is going to help us in here trying to understand the interactivity with this kind of solutions. And it was very helpful. So in the end, the pilot has started. We are almost finishing it. And I would like to thank Future Healthcare, Healthy Systems, and PLUX also, because they've been working with us since the beginning. And we are very happy with this solution. Also, and final, it's our great team that is behind all the from the development of these case studies, and I hope it keeps growing. And now I will jump very quickly for our enormous panel, because I have here people that I know for a while, been working directly and indirectly, or even in presentations. And the format from the roundtable, it's supposed to be fun, for the first point. The second is for us to discuss not only good things, but bad things. So everyone could get out of here with something to work on it, and to start collaborating. Professor Ana Rodrigues works at Nova Medical School as an investigator and as a professor. Dr. António Reis Silva is the marketing director at Vodafone, whose background is in engineering. Professor Jaime Acosta Gómez is member of the executive committee from the community pharmacy section. This is very hard to do it, but he's also a professor in the Pharmaceutical University in Madrid. Professor Nuno Correia, which is a professor in Nova University in FCT, and engineer Pedro Duque, which is the R&D service senior manager at PLUX, and both as an engineer too. So after I spoke so fast, I believe that you are all tired. I'm not, because this is the best part of the workshop. I will start with the first round of this presentation, letting each of you present yourself if I forgot something, and also to tell me and everyone what is your interest in digital health and outcomes collection, and then we move for the next round. So 2 minutes for each one, and I will start with the ladies because we just have one in this here. So Anna, please, you can start.
Hello, everybody. I will start to thank the all team of Value Collab, and in the name of Ana Rita Londral, for the invitation to be in this round table. I'm a medical doctor, I'm a rheumatologist, I'm the rheumatologist coordinator at Lusíadas Hospital, and I'm also a clinical researcher and a professor at Nova Medical School. My interest on digital health started when I worked, and I'm still working, at Terceira Island in Azores, because I was there only for a week, and I need to maintain my contact with my patients, because my patients are chronic patients, and they have needs that are not only when the clinical appointments happen. So I need to identify a way for us to communicate, and I needed to have a team with nurses, pharmacists, other medical doctors from other specialties, and the patient, and we all need to be connected. And these needs for connection and interaction that goes behind the doors of the hospital started me to think that digital health could help in this precise moment. And I started to elaborate some projects in order to help and empower patients. And I did some pilot studies with interventions that helped patients to change their lifestyles and things like that. So that's my view, is that digital health and new technologies are just a mean to help the pathway, like Salome said, and I completely agree. So you need to identify where the digital health in the patient's pathway would be helpful and will not reduce costs, because it always lead to, this is not our main point, is to have the value.
Thank you, Anna. Antonio, can we jump to you now? You're mute. Technology, right?
Yeah. Hi, everybody. Well, my name is António Reis Silva. I work for Vodafone since the second generation. So I live at the jump to the third, fourth generation, and now the jump to the fifth generation. Fifth generation will be a very disruptive, meaning we are jumping from from the velas, I don't know the name in English, to the lamps. So, and the highest impact in the diverse industries, economy, sectors, etc., will be in health and industry, by curiosity. Okay, so health will benefit strongly from the 5G evolution, since we have new capabilities that we didn't have before, and we are living this evolution. In my youngness, it was impossible to have a meeting like this one. Okay, so more health will have a strong impact on the economy. I think we are more aware of this at this time after the pandemic. Okay, and addressing the challenge that Salome shared with us, who will do things happen in this area, I think will be the community together. Firstly, because citizens need to share their data. Secondly, because technology and the medical area needs to cooperate in order to cross the knowledge. Okay, crossing knowledge will emerge new capabilities. It will be impossible. But I should raise the question, the risk of the monopolists of data, like Google, etc., compete in the medical area. So we are not at this stage. We want to cooperate with everybody. Okay?
Thank you. Yes, thank you. And we will talk about that later. I think I have some questions for that. So Jaime, I will jump to you now.
It's a pleasure to be with you today. Thank you so much for the invitation, Salome. I hope it's useful for our listeners, for our viewers, and it's a pleasure to be with such a very nice panel of speakers. I'm sure I'll learn a lot. So I'm a practicing community pharmacist, and as you know, pharmacy is a pretty traditional business, stable for, I would say, centuries, decades. But I'm obsessed with the promise that digital health brings to pharmacy, not only in terms of product delivery, which is super important, and you are all aware of new disruptive companies that are specialized in logistics, very fast, very efficient, and that's a huge challenge for us in community pharmacies. But even more than that, I try to be more focused on digital health services. Not only because it improves patient accessibility, community pharmacy is the champion of patient accessibility, but digital health, digital technology is the next step for us. Patient convenience, which is a huge change driver. It will allow us to provide more robust and higher quality care models in terms of using technology that records, tracks, allows us to follow a specific flow of actions that is common to every pharmacy, etc. And I'm also involved with international pharmacy organizations. I try to put national pharmacy organizations in the focus of digital health. It's a huge opportunity for healthcare professionals also, and especially for community pharmacies. And I'm also, as Salome said, involved in teaching individual future practitioners the advantages and huge challenges that digital health brings to healthcare.
Thank you. So I'll jump to you now.
Good afternoon, everyone. I hope that the sound is fine. So I'm professor of computer science at the School of Science and Technology for Nova, which I'll change name, so Nova SST. And I'm heading a research group on multimodal interaction, which is part of a research center called Nova Links. So we are about 12, let's say, integrated members, and we have many PhD students. So my interest in this area is mainly because we work on human-computer interaction in different contexts, and of course, health is probably the most challenging context for human-computer interaction because there are human problems, there's technology. So my interest in this area are mainly to experiment with technology, but always considering the human, and sometimes, because it's unavoidable, also the political and organizational side. So we have this. Of course, I like technology, I like gadgets, and I'm always excited by new technology, but that does not solve problems in general. So we have to put that to a test. And of course, health is probably the main or the more challenging test that we can have technology experiment. So that's mostly what I'm interested in, to build technology where this idea. I've been saying this and working on this for a long time, so not really replacing humans. I don't think that is even a goal in most systems that we do. So it's mostly to work together with human users in different areas, helping with technology as advanced as possible, but sometimes we really don't need all the advanced technology that we have. So it's always having this range of technologies that it's available and choose whatever is best for a given task. So that's my take on this panel and why I'm working on this as well. I just forgot to mention I'm also on the board for the collab, so trying to help. I'm not involved in the day-to-day, so I'm just to thank for being invited, and I don't have any credit on the results of the collab, which are so many now. But I'm involved as a member of the board and trying to provide some ideas and suggestions.
Yes, definitely. Thank you. So last but not least, as everyone says in all the panels, Pedro, Duque.
Hi, Salome. Hi, everyone. So I'm Pedro. I have a background on physics, engineering, and also biomedical. So I've been working at PLUX. PLUX is a company with more than 15 years experience in getting physiological data from the human body. So we have a huge portfolio of sensors, and I usually say if the body generates a signal, we can measure it. We have a sensor for that. So we are quite interested to go deep in this digital health sector, because we think we can make a difference there. By participating in these projects like we are doing with the collab. And we think that the cities will need to get access to their physiological data, to know their vital signs. This is already happening with these wearables and these gadgets, but this has to evolve, be simplified, be more reliable in terms of data quality. And I think PLUX will make a major role in this, perform a major role in this goal.
Yeah, definitely. So first round is done. We know each other, so we can go deep down now in for the second round. And the main focus of the second round is for you, each of you, tell main opportunities and concerns. But you can use like your life experience, your work life experience, of course, in trying to explain the audience what is so different and what is so different from what we expect to be digital health. And we that work in the area, in different areas, of course, and as a medical doctor, Pedro as an engineer, and so on. So try to come up with opportunities and concerns that you as a professional see in this sector. Okay, I'll start again with Anna so we can move around, and I would like to see your opinions on this.
So, as I previously said, for me, digital health is not a thing. So, as a health provider, what I can use is the new technology to improve what I do. Okay, so to make so I need to improve the way that I provide health and engage and help and engage patient on this system. And when we say that we do patient-centered approaches, we really need to do patient-centered things, people-centered things, right? Citizen-centered things. What this means coordination. And the first problem to introduce a new technology in the health system is that we need to improve the health system coordination. And so that is independent of the new technology, something that is completely different. So this is the first barrier, that we need to improve our health system, and then at the same time, while improving this coordination, we have value with the new technology. And for me, this is the main barrier, because the seizures, and I'm sorry that we don't have in this panel people that decide things, but what we need to show to the seizures is that probably by having health, at the beginning we will not reduce costs, but we will have value. We will improve people's satisfaction, citizens' satisfaction, improve citizens' health, and this should be our main goal. And for me, this is the main barrier: is that the health system in Portugal is not coordinated, and when we introduce new technology, if we don't have any coordination without the technology, we cannot introduce that. The opportunity is that with this COVID pandemic and the health system was pressed to be more coordinated and was pressed to provide health at distance. And so, although we had many challenges and we did not went good and we could be more prepared, all of us in the world, what the COVID-19 pandemic shows us is that it is possible. So we know the way, and we know that new technologies can help in this way. So this is the greatest opportunity, is to rethink how we provide healthcare and understand how the new technology can be useful.
Yeah, definitely. So we saw that, and I think I'd like to see how the engineers would answer to that, because we saw for over years labs developing new technology, but didn't see them being adopted in healthcare. And in less than 1 year, everyone was doing teleconsultations and trying to adopt this technology. So well noticed in that. So we are humans, but only under pressure we can really work on it. I don't know, Jaime, do you want to add something on here, or something totally different? It's up to you. So it's your 2 minutes for opportunities and challenges.
Let me put you 2 examples from my personal experience. I advise 2 companies in Spain that are providing digital health tools. One is a very big medicine wholesaler that provides digital health tools to final users, but through pharmacies. And we developed, not exactly as the one you did, to collect blood pressure results and oxygen saturation for COVID patients. So pharmacists received an alarm whenever one of those values was higher than normal. So they could get in contact with the patient to check with them. But patients did not see the use of that. They wanted to reach their physician, no matter that they really trust pharmacists. So we spend a decent amount of money because we didn't ask users if they wanted to receive this service, even though it was for free. So this was a very big mistake. That's one mistake. And the second mistake, I also advise a company that digitizes the stock of pharmacies, so a user can know where he or she can find the medicine they need. When it's on shortage, for example, instead of going pharmacy by pharmacy, walking or phoning, they have the access to an app, and the app tells them what pharmacy has the product they need. And this is sometimes a big difference for them. So one mistake we did with them is that, of course, we checked the legality and the regulation. Very important lawyers advised us, but we did not check with the right stakeholders, not only that could have benefited us in terms of deployment and implementation, but some of them felt challenged. So they put us every stick in our path that they could, and this has costed us a lot of money. And a lot of time. So that's another point for me. Do a right mapping of the stakeholders you need to approach, so you can have them on board, hopefully, before your journey starts, or at least them being neutral and not against your project, because this was very surprising for us, but not unexpected. And we should have done it differently and better. That's my 2 points.
And opportunities, do you have one like that you'd like to say? COVID, like based on your experience now, like COVID, in these 2 mistakes?
COVID has been a very big opportunity for these digital health services that I mentioned, and also in terms of medicine accessibility, because there was a new regulation in Spain in place that allows pharmacies to deliver medicines to the home of the patients, which was illegal before the pandemic. So we could, in that company that told patients what medicine, what pharmacy had the medicine in stock, we could link it to delivery companies that sent the medicine straight to the homes of the patients. And this has been a huge driver for having patients involved and using the technology.
Cool. Okay, thank you. So I'll jump to Professor Nuno. Do you want to add like your opportunities and challenges?
Yes, sure. Yeah, I think on one level we have all these new technologies that we can now really use, and they are of course opportunities. Although even in the past we had technologies that could be used and in some ways were not because of other reasons. So it's not that different, I think. But there are really, in a way, new stuff that we can use. I think there's some noise in my background, so sorry about that. We now have new ways to collect data, and we can collect a lot of data and information. That's quite different, and we can process that data. We have many sensors. That's not new. This colleague from PLUX, we have worked with PLUX as well. So there are many different ways with, let's say, easy to use sensors to collect different types of data, and that's quite a good opportunity. Also, new ways to interact. So we have new ways to display information. We now know more about information visualization, interaction in general. We know more about using data to drive interaction as well. We have, for example, voice-assisted technology that can help and provide more natural dialogues. So I think all of these are really opportunities at the technology level. But as I mentioned, and sort of echoing the other participants as well, that's just a small part of the equation. So we have the technology, there's more awareness. We have to make it, one challenge that we have is to make this technology available and easy to use as technology to everyone, making people know that it exists, it can be used, making ourselves available to participate in projects. So all of these I think we can do on our side, let's say from the technology side. And then the thing that it's really hard to do, and it was mentioned before, it's to involve both potential users, and users can be patients, can be doctors, and of course the stakeholders. And that's our experience is like that as well. So we have these ideas that we want to experiment with, and there are many different levels where it's really difficult to introduce new technology because there are legacy systems, for example, at the system level, or because people just don't understand the value of what we are proposing. So even from my side, if I do projects that are just one more note before finishing. We have this sort of method that is used in other areas as well, which is user experience design. And I think that if really employed can benefit a lot this process. Sometimes we can do it, sometimes it's more difficult, but talking with people, having participative design sessions, it's part of the process and we try to employ those methods. There are some organizational aspects that are a bit outside of what we do, and sometimes that's where the struggle is, trying to, let's say, help, but there are some of these issues that we cannot really solve alone, at least.
Yeah, but I think it connects really well to Jaime problems that he did that he suffered during the two cases, and also Anna when she explained the introduction and the adoption of technology in the healthcare. I will jump to António and get the opportunity to mix now a little bit with the industry, and then I'll finish with Pedro because it's also from industry. You that work in Vodafone and Pedro works also in PLUX. So as the industry players, how can we from the academia parts and also the doctors and the pharmacists could present these use cases for you so it becomes attractive for you guys to collaborate and to cooperate in order for the service gets better, right? Because Vodafone, it's a very good telecommunication provider. PLUX, it's becoming a very strong product devices the developer and provider also in healthcare. So how, António, do you see Vodafone cooperating more and in order for us to reach a halfway pathway, right? So in that sense.
Yeah, let me explain 3 layers of knowledge here. I will try in 2 minutes, okay? It will be difficult. A good challenge, okay? So Vodafone is a telecommunications provider, but all telecommunications providers are moving from telcos to tech companies. And this evolution requires partnerships with other players in the market, since some of the solutions are already developed. But it is the unique way, the only way to justify the investments we are doing, okay? So we are giving much more telecommunication services and receiving less money, okay? So investment is growing 30%, and the revenues are growing 2-3% in the industry. So we have a strong challenge and we need to introduce new pillars. 5G will facilitate this, but we are already working on the cloud area, IoT area, etc. So related with the opportunities you see here and talking as citizen and also as worker at Vodafone, let me summarize this way. First, we are enlarging our capacity, the life capacity, and our life expectancy, because we generate the data, but we don't store the data, okay? And if we connect ourselves, we can generate this data and run analytics, okay? So the ecosystem of the telecommunications is advanced and generating the opportunities, yes, clearly. In Portugal is a little bit advanced. We can say that more than 80% of the population is using a smartphone. More than 80% of the population has access to the internet with broadband in the fixed side and in the mobile side. So this allows connecting people and computing people, because smartphone has computation capability. So this is a strong opportunity because we have the ecosystem. So I will jump to 5G, okay? But I think we have a strong opportunity with the conscience we have about the impact of the health in the economy and the funds, European funds we have to apply in this area. And in Portugal, part of the funds are allocated to the health system. Related to what Hannah referred before, yes, probably will increase some costs, but if we invest reducing the costs and preventive medicine, detecting problems before the symptoms are strong, is something that will generate a strong value for the community. Okay. Related with the drugs, because we have a pharmaceutical company here, we know that India and China, we are generating corruption in the generic drugs, okay? And if we can monitor how they are developing the drugs, will be very useful to us because they are bringing some problems with the generic drugs, which is a very good initiative, okay? And the other question I would like to raise is the supercomputation, and namely the quantum computation will open huge opportunities to develop the new remedies, the new drugs, because developing a protein is something that generates a strong problem, takes 10 years nowadays with hundreds of persons, and with these new capabilities we can do in less than 1 year what we are doing now in 10 years, okay? We have problems here, yes, just raise 2 or 3 concerns. Firstly, cybersecurity is also very important in the health area, okay? Secondly, how to collect and retain data in a share, in a fair mode, okay? So we should invite the citizens to share the data, but if we generate value with the data, we should share the generated value with the citizens and not doing as Google is doing or Amazon at this stage, okay? They are generating a strong revenue with the citizens' data and the people are not earning with this, even in the taxes, okay? So we have some challenges here. Okay,
no,
sorry
definitely.
about the time.
No, very good questions, and I believe I saw a lot of most of the faces trying to interact and saying that you were doing a good job. But I have to give the final word to Pedro because we are running out of time. So Pedro, now the challenge for you. I told you that you were going to say opportunities and challenges, but I would like also for you as a physics engineer. That has a long experience in engineering also, but in healthcare, to try to connect the dots now that Antonio said, and join that with PLUX, because you lived on data and the future is data for sure, but this data must be meaningful for the healthcare professionals to act upon it and also have a role for patients to be part of it. And I really like the idea from Antonio that patients and citizens, because we are all citizens in here, should be aware that we are providing data, but we get something in exchange. So I will give you the last word of this panel, and I will thank everyone of us. Go for it, Pedro.
Okay, I think we have common grounds here. All of people here talked about something that I think we all agree. I can state that from engineering point of view, we see the enormous challenge to understand the end user requirements, to see how we can help really people using technology, how we can make it easy. So UX is a key thing here. So involve all the stakeholders, the medical doctors, the end users, to really see how we can adapt our developments to them. Then we have other challenges already mentioned here also. So it's getting this data to a cloud service. So we have to have this infrastructure, like António from Vodafone said. The 5G will for sure enable or facilitate this data exchange, because what we are creating here with all these wearables, all these technologies, a huge amount of data that we didn't have before. So we were used that people going to the hospital generate the data at the hospital that will stay there, but now people will generate their own data. They will be aware of their own data. That's something that was already mentioned here. We have to also invest here something on the literacy side of the technology, so help people use that data correctly and understand what they are delivering as a service. And therefore, I think it's this all connecting all these dots that all the involved people here will add something. It's really important to bring us together and talk and generate these consortiums and these ideas to really see how each of us can complement each other. And I think this is already an opportunity that rise up from the pandemic. We saw a lot of companies getting back together and trying to set up a project like we did, Salome, with the collab project. So I think this is a big opportunity already arising from this pandemic. It was happening before, but now it's speeding up. But yeah, from the engineering point of view, that's what we miss and what we think that it's difficult usually is really involve the stakeholders, understand how to design the technology for them, and then have the right partner to deliver what we do in a way that creates an impact, in a positive impact in the society. So the right partner are the stakeholders, for example, that are here in this forum.
Thank you again, and I will finish with some words. I'm sorry because we cannot go for another round. We got shortened of the time, but I hope everyone enjoyed. At least I did. I think one key point that Pedro already mentioned, but one key point from this panel is that actually with the research funds from the European level, national level, we could cooperate. Spain, Portugal, of course, with nuestros hermanos, podemos. We could do it, and we could come up with a new value network and new opportunities for healthcare, connecting industry and academia, knowing that both sides have different indicators and performance indicators to succeed. I thank you all, and I will have to jump for the next panel, but I hope next year we'll be joining together physically and discuss with more time digital health. Thank you all.
Thank you. Good afternoon.
Thank you. Have a nice day.
Bye-bye. Bye-bye.